For the past 4 years, 2028 to 2021, IntraHealth International led the regional health integration to enhance services in Eastern Uganda activity, which has developed the capacity of the government of Uganda and key stakeholders to make high-quality health services more widely available in 30 districts, 25 in Eastern Uganda and 5 in Karamoja, by strengthening health systems and improving the quality of, access to, and demand for health services with attention to equity and underserved populations.
As USAID, we have been doing integrated health service delivery within these districts for the last 5 years. And of course, as the mandate of USAID, we are mandated to transition in our 5th year, and we transition HIV/TB service delivery to local partners. We have 2 local partners whom we transition to HIV and TB. That's ANECA. Then we also have Bela Uganda.
RHITES-E began the actual transition program in September 2021 using the above-site technical assistance approach provided to one government-to-government awardee. Moroto Regional Referral Hospital, 2 local partner health services, African Network for Care of Children Affected by HIV and AIDS, and Bela Uganda, and 1 local services delivery activity, Uganda Protestant Medical Bureau. The above-site capacity development technical assistance focused on program management strengthening for local partners, continued health system strengthening at the district level, and ensuring the continuation of services in the context of COVID-19.
Many districts have adopted this approach and are actually coming to terms to the current operation of RHITES-E as an above site. For example, Bududa has Cottonwell and has, in addition to the technical working group, they have innovated a district-level integrated task force for implementation of health services.
We have intentionally collaborated with local partners, the USAID team, and district health representatives to learn and implement the transition. The provision of technical assistance and above-site support was done through coaching, mentorships, joint supportive supervision visits, data to action or D2A meetings, various capacity assessments, and learning sessions to address capacity gaps of local partners, and this has accelerated the PEPFAR transition in the region. For the PEPFAR transition, we have moved from district support of service delivery to an above-site capacity building or technical assistance to local partners, to strengthen their abilities to carry on the transition. In February 2022, the Chief of Party Summit was held together with IntraHealth, where transition plans and expectations were harmonized to accelerate the transition activities. The transition implementation of PEPFAR activities is in progress till September 2023.
So far, it is so good, and we have achieved and we have been able to showcase the results of this transition, basing on the number of indicators that we are monitoring with them. We are seeing that given the transition, we have not noticed a decline in the indicators that we are tracking, the indicators that are being tracked by the donor.
RHITES-E communicated to the district about the transition of RHITES-E support from direct implementation support to above-site support. Through this process, RHITES-E innovated technical work, district-level family health technical working groups, in addition to the district-based mentors that have been trained by RHITES-E.
Personally, I don't think we should go beyond a month without having a facility data review meeting. And that meeting should really be attended by a staff.
We make sure that there is a biostatistician in the technical group. He takes up the analysis on the indicators and is able to talk to the district health teams on where efforts should be meted. Our level of effort has been to really support the community component, what we call 097B, because they don't have the real resources to reach out to the communities.
IntraHealth implemented specific tested technical approaches which ensured a successful PEPFAR transition with local partners and the government of Uganda by actively mobilizing and engaging the 3 local partners, 2 RRHs to plan and execute the PEPFAR transition.
USAID RHITES was able to develop the change packages of the best practices, the best interventions that have worked all us through. And these packages were actually disseminated at a regional forum. So this has supported them in such a way that they are not reinventing the wheel, but they are using what has been working to be able to carry on with the services.
Quality improvement, it's also one of our HSS mandate, which we are supporting districts to ensure that there's functionality of regional QI committees, district QI committees, but also facility QI committees. As you know, quality improvement is one of the key approaches which is geared towards improving service delivery. So as RHITES-E, we do support QI interventions at regional level up to facility level.
We have seen a lot of impact that the project has helped us to register. We've registered a lot of improvement in very many various indicators. We've seen all this improvement because we are able to assess ourselves and we see where improvement is required. This is how far the RHITES-E activity has taken us from the poorly performing indicators to at least now being among some of the good performing districts.
We have supported 2 local partners on electronic medical records, EMR installations, to monitor patient outcomes and improve quality of HIV and TB care in 6 health facilities, and the use of EMR has also facilitated local partners to efficiently respond to USAID routine data calls, and this has impacted communities in the region.
The community still needs a lot of sensitization, especially for the services that we provide in the health facilities. And still there are some methods of family planning you'll find that are not easily acceptable. The other challenge would be, of course, limited funding since the RHITES-E activity is ending. And of course, the RHITES-E activity has helped us to prepare us for transitioning. Actually, they've prepared us. We've formed a technical working group that will make sure that the activities that the RHITES-E activity has been supporting go on, and we continue performing well and not decline in our performance.
Amidst all the success and challenges faced during the PEPFAR implementation, there is still a need to leverage G2G mechanism to strengthen family health using hub and spoke approach, utilization of data to provide family health targeted support to districts, to continue advocating for increased health sector financing and documentation, and experience sharing to make the story come true.
I want to really thank the IntraHealth and RHITES-E activity for all the technical guidance that they have given us as a district, but also in a special way thank the USAID for supporting this activity and funding the RHITES-E that has enabled us to register a lot of improvements in the delivery of maternal and child health care services in Bududa district.